guys need to see this.
First of all, people should know we're not taking vaccines away from anybody. If you want to get the vaccine, you can get it. It's going to be fully covered by insurance, just like it was before.
But it is more difficult now for parents to get their children immunized for the flu, right? They can't just go to a pharmacy. They'll have to consult with their doctor first.
You have to. You need to do a shared decision-making with your physician, which is how it ought to be.
Fewer people will get the flu vaccine.
Well, that may be, and maybe that's a better thing.
Based on what evidence? There were 280, 290 kids who died last year due to the flu. There's no evidence that any kids died or were harmed due to the flu vaccine. So isn't this inevitably going to lead to more children dying?
The Cochrane collaboration, which is kind of one of the ultimate arbiters of vaccine safety and clinical data, has done an extensive meta-review of the flu vaccine. And they found that there is no evidence that the flu vaccine prevents serious disease or that it prevents hospitalizations or death in children. There's no scientific evidence, and what we tried to do is to follow the science.
90% of the kids who died from flu last year were unvaccinated for the flu.
Honestly, it's so scary that this person is who is pretty much giving out medical advice when it comes to vaccines. Now, yes, he is right that the Cochrane Review did not establish that flu shots do not prevent serious outcomes like hospitalizations or death in children, but it didn't show that it does cause them. Also, it does mention, because I think he just really reads like the cliff notes when it comes to this stuff, that the evidence from the clinical trials at the time was insufficient to measure those severe outcomes reliably. But what we do know is that flu shots do reduce flu infections in children, because as we are seeing, as less people are getting vaccinated, there's more cases. It honestly doesn't take someone doing kindergarten math to know that.